Good evening, everyone. This is Dr. Leslie Torres Rodriguez. I'm your superintendent, and I want to welcome you to our town hall for families. This evening, we will be discussing the return of our remote-only students to in-person learning. And before we begin, I do want to just take a moment to welcome some of my amazing team members that are going to join us this evening to answer some of your questions. Ms. Deb Kamaitis, our Coordinator of Health Services, Mr. Ed Wilson, our Staff Attorney, Chief of Schools, Yvette Avila. The three of them are the tri-chairs of our Health and Safety committee at the district level. And also joining us is Dr. Bethany Silver, our Chief Performance Officer, Chief Sherry Davis-Gooch, who is our Chief of Operations, our Dr. Madeline Negron, our Chief Academic Officer, Chief Nushet Black-Burke, who oversees the Office of Family and Community Partnerships. We also have our Senior Director of Student Supports, Ms. Jen Hoffman. And I am also so pleased to share that joining us this evening also is Dr. Rowland, who is Chief Medical Officer at St. Francis Hospital, and who earlier today when I introduced him to our staff, I told staff that many or some of our staff already know who he is, given that he actually was the doctor administering vaccines to some of our staff. And so he is here this evening to share some learnings that he has had as it relates to COVID, some recent new research that he has learned about as it relates to the effectiveness of the vaccine, and any other learnings that he wants to share with us as it relates to COVID and safety in our schools. So I want to welcome the team and welcome you all to the town hall this evening. And what we are going to review is what is happening on Monday, March 29th, given that we're going to welcome more students into our schools, an update about our local health metrics. We're going to review our return to learn timeline, and then spend some time talking about the in-person student experience, especially to review some of our health and safety protocols. And then we're going to have some time to answer your questions. So we're actually going to start with a quick review of the survey that we have sent out to families, and I'll ask our Chief Performance Officer, Dr. Silver, to just give us an overview of what those responses look like thus far.
Thank you so much, Superintendent Torres Rodriguez. This is a summary of our survey, and I wanted to thank you so much for the families that participated in the survey. We surveyed about the families of about 9,500 students. And on the left, we see that the green part of the pie, 49% of our families of remote learners participated in the survey. So thank you so much for that. And on the right, we asked the question if there were any barriers to returning to in-person learning. And approximately 60% of our families shared that their student does not have a barrier. That's 2,827 of the responses. The family said there was no barrier to returning to in-person learning. And that concludes my summary, Superintendent.
Thank you, Dr. Silver. So a quick review of what exactly is happening on Monday, March 29th. In consultation, as we have been consulting since the beginning of the pandemic, we've consulted with our Hartford Health Department, and also based on guidance from state health officials, beginning on Monday, March 29th, our remote-only students will have the opportunity to return to in-person learning 5 days a week. with Wednesdays remaining as a half day. We are encouraging our remote learners to return in person. And based on the surveys, as you just saw in the previous slide, we know that many of our families are looking forward to having their child safely return to school and to our classrooms. And we understand that some of our remote only families still have health and safety concerns and other extenuating circumstances, and they don't feel comfortable returning at this time, and they can continue to learn remotely. We will continue to enforce our existing health and safety measures that reduce the risk of spreading of the virus. And we're going to review that in more detail in a few minutes. But I want to take a moment to talk about why it matters that we have students back in our classrooms, as many students as possible, returning to in-person learning. We know that it is important for us to offer equitable academic opportunities for our students. And so we know that remote learning, while it does work for some families and some students have a support system that is established, and that students have an opportunity to engage with their remote learning model. We know that that is a model that isn't working for many families. We know that our chronic absenteeism, although we had made progress improving attendance prior to the pandemic, we know that 48% of our learners were considered chronically absent in December. We have improved through our recent attendance efforts, and we've reduced that to 44%. However, that's still double. It is double where we were prior to the pandemic. We also, have to think about student learning. And while we're still trying to, put all of those pieces together in terms of what exactly is the big picture with regard to student learning, we do know that we have some pieces that we are well aware of. One is that we started the year with 25% of our students reading on grade level and just 8% of our eighth graders on grade level for math. And we don't have much evidence of major improvements when we shifted to more remote learning. So there's still a lot for us to learn. And while we get there to getting that complete picture, we do have some concerns and want to make sure that we allow opportunity for students to have access to in-person instruction and all of the other supports that we know students can access in school, in person, every day to meet the social, emotional challenges that some of our students are experiencing. This is actually a slide that you might recall. It is a slide that we're carrying over from the last family and community town hall that we had in February, where I wanted to share with everyone what the next steps were. At that time, in February, during that town hall, we were discussing the return of our pre-K-9 in-person students at the beginning of March. And I also shared that we were going to get ready to share or send our families the survey. This was the survey that Dr. Silver spoke about for families who had opted for remote only learning at the beginning of the year, and that we were getting ready in a week or so back then to begin vaccinating our staff. And then the last two steps that we had were going to be the return of our remote only students to full in-person learning, followed by the second dose of vaccination for our staff. And so we are exactly where we were saying we were going to be. And we are grateful that, for example, we've been able to vaccinate so many of our staff. And in between those steps, knowing that we have maintained our commitment to our health and safety protocols. And to give us a quick overview of where we are with regard to staff vaccination, I'd ask Ms. Deb Kamaitis, our Health Services Coordinator and key lead in our COVID health and safety team, to let us know where are we and where are we headed with vaccination.
Thank you so much, Superintendent. To date, 2,193 of our educators, staff, and school-based partners have already received their first dose of the COVID vaccine on March 4th, 5th, and 11th. We're very excited that starting tomorrow, they'll begin receiving their second doses of COVID-19 vaccine, and that will go through tomorrow, Friday, and next Thursday, in partnership with Trinity Health of New England.
Thank you. So this is just a view of, what things will look like in terms of our return of remote only students to school on the 29th. We certainly understand that some remote only families, as I said before, still have health and safety concerns. If they're not comfortable returning at this time, they will continue learning remotely. And our schools have been doing outreach to our remote only families to confirm their decision as to either returning or staying remotely, and also to determine if there are any supports that we might be able to provide our families. So I want to just take a moment to thank our school-based staff, our leaders and their teams at the schools for their outreach, and knowing that we want to make sure that we continue to do that outreach as we get ready to begin our fourth quarter and get the students that are going to return to school and those that are going to stay at home, ensure that they have everything that they need so that we can end the year really strong in the best way possible, get ready for our summer opportunities, and then plan for the next year ahead. So we always look at what the local health metrics are. That is one key piece of information, piece of data that we always use to inform our conversations, our decisions, and our planning. And local health metrics in the city of Hartford and in the county confirm that the COVID-19 cases and the positivity rates have been declining and are now similar, or actually probably a little lower than what they were in the fall. The numbers in Hartford are down from the peak that we saw and back in November, for example, when we had to shift to more remote learning. We know that the peak of the second surge significantly across all of the key metrics has decreased. The cases, the positivity rates, and even the hospitalizations. And we are so hopeful that with the ever increasing number of individuals receiving the vaccine in our schools, our staff, and even throughout our communities, we're hopeful that the positive cases, the number of cases, and other key metrics will continue to decline. And as of yesterday, for example, the 14-day average of cases per 100,000 was at 14.3%. And comparing that to where it was in mid-November when we had to shift, the 14-day average back then was 76 compared to 14.3 now. And the positivity, the percent positivity now is 1.8, whereas back in November it was 6%. So clearly, not only as you can see here in the visual, but also with regard to the recent 2-week period, there has been a significant improvement and reduction. You've seen this display also. We've sent this in some of our communications home, and it shows us from the beginning of the school year our district-based positivity cases bi-weekly, by week. And you see here total to date, 409 students, or 5.6%, have tested positive, and 10% of our staff have tested positive for COVID, a total of 328 staff members out of 3,400 staff members from the beginning of the year. So you see the trend here as well, right? It has continued to decline. So we'll take a moment to dig into the in-person student experiences as it relates to safety protocols and mitigations. And I'll ask Ms. Debkamaitis also to share with us what those look like.
Thank you. All of our health and safety measures will continue to be in place in all of our schools. Masks are one of the most important mitigation strategies that we have. Masks will be required for all of our in-person pre-K through 12 students and our staff. Mask breaks will be offered during the day and at meal times, of course, with students maintaining distance from each other. And face shields are always available upon request for both staff and students if they would like them. Bus transportation, eligible students will be contacted with their bus schedules. Buses are cleaned and disinfected after each trip and at the end of each day. Face masks are required by everybody on the bus, and windows will be open at all times on all of the buses. Physical distancing, we will continue to practice in the schools to the extent possible. Foot traffic and patterns in the hallway, in the halls and stairwells are one way. And pre-K through 8 students will move in cohorts to minimize contact and exposure. PPE is readily available in all of our schools for staff and students. Every school has what's called a PPE captain. And that person is the one who makes sure that there's enough PPE for anybody who needs it in the building.
Thank you, Ms. Kamaitis. And just a reminder that our health and safety measures focus on reducing the likelihood of person-to-person transmission, making our facilities safer for not only students, but also staff, and monitoring the virus cases and contacts. We have dedicated staff that engage in the contact tracing. We communicate regularly whenever there is a positivity, a case of positivity. And before I ask Dr. Rowland to join us in sharing his expertise with us, I do want to share an update. And as of today, we know that we have about 2,500 of the students that are learning remotely that are going to join us starting on the 29th. And the majority of those students are in K through 8th. And so that is about 26% of the students that are learning remotely, given that we have about 9,500 of students that have been learning remotely. And like I said, about 26% of those, or 2,500 students, are scheduled to join us in person. So I'm now going to ask Dr. Rowland to join us and share from his perspective, what his thinking is about some of the things that we always hear about, Dr. Rowland. One is the distancing.
Right.
One is about vaccination, and what does it mean when a staff has gotten their first vaccine, students are returning before staff gets the second vaccine. What does all of that mean?
Right. Well, thank you, Dr. Torres Rodriguez. I really appreciate the opportunity to join you and our community tonight. I first have to thank all of our teachers and support team that have participated in our vaccine program with St. Francis and Trinity Health of New England. and we're well on the way working together to end this pandemic. And I really want to commend you and the school for this rigorous, detailed program that you have in place to protect our children, our families, and our teachers. And the points that you have here are all things that we practice even in our healthcare environment. We know that face mask, use of masking, is the single most important protective factor in keeping the virus away. Hand washing, hand sanitizing, careful hand hygiene, equally important. And physical distancing is very important. You know, in the very beginning of the pandemic, we were told to stay at least 6 feet away from each other. That was based upon historical data from the 1980s with other infections. It was certainly a good idea as we entered this pandemic a year ago. Now we're well a year into the situation, and we've learned that, particularly in the classroom setting, that a separation of 3 feet is very appropriate and maintains a safe environment. And so physical distancing, 3 feet when possible and appropriate. And yes, we're very thankful that our teachers and all the support staff have participated in our vaccine program. Everyone has had their first dose of the Pfizer vaccine. They'll be coming back starting tomorrow for that second dose. We know protection with the vaccine begins probably 2 weeks after your first dose. And in fact, a world large study actually showed that just one dose of the Pfizer vaccine was 75% effective against severe COVID disease. We certainly want everyone to get both doses because the effectiveness peaks likely 2 weeks afterwards. The important point, though, is that right now in this pandemic, with careful use of face mask, hand hygiene, appropriate distancing when possible, and participating in a vaccine program, we're really at the safest time ever of the pandemic. And it will only get better, as you noted earlier, Superintendent, as the number of cases in our community continues to decline and we get more and more people vaccinated. I think the future is very positive. I'll pause there.
Thank you. Yes, I do agree. I'm very hopeful that collectively, right, we can get to a place in which we're all safer. You know, one other wondering I had, Dr. Rowland, is any learnings that you have had in your own space, in the medical field, in the medical space as it relates to protection and exposure and the mitigation strategies.
Right. You know, we have an incredible team of nurses here and physicians that have worked with COVID patients over the past year. And one of the things we've learned is that with proper protection, face mask, hand sanitation, washing your hands, and appropriate distancing, it really protects our healthcare providers from COVID-19. So using all the factors that you have in place within the schools, plus adding the vaccine program, reassures me that we're in a safe situation for our students, our teachers, and our family.
Thank you. And in our next slide, it's another slide that you've seen before. And this is a reminder of supports available to our families. And I'm going to ask Chief of Family and Community Partnerships, Ms. Nushette Blackburg, to speak to supports available to our families.
Thank you, Superintendent. To our families that have joined us tonight, first, thank you for doing so. And I wanted to share that, yes, the Welcome Center is ready to assist you, to answer questions, and to provide you with additional resources. So yes, reach out to your school. And if your school is unable to assist you with things like uniforms, shoes for your students, please feel free to reach out to the Welcome Center so we can assist you. We are really excited to have students back. We want to ensure that they are ready to go on Monday. So if there is something that we can assist you with outside of uniforms and shoes, that's okay too. Just reach out to the Welcome Center, and we'll do our best to address those concerns and get your students and yourself ready for March 29th. Thank you.
And for the families that are not returning to in-person learning, know that there are still supports that are available to you as well. You know, our virtual tutoring supports, those are still available. Our telehealth, our meals are going to still be available for students. So please know that whether you are deciding to return and join us in person or deciding to stay home, supports and services are still available. And now, actually, we can shift to answering some of your questions, and either I or my team will answer your questions.
Thank you, Superintendent. We have questions, a mix of questions that are coming in through the chat. And if anyone wants to add questions in the chat, you can add them there now. But we have some, and as well as some questions that came in through our Welcome Center. First question that was asked several times, and also in the Welcome Center questions, if I have concerns over health and safety, whether for medical reasons or other circumstances, or just concerns about COVID, do I have to return in person at this time?
No, all students that are learning remotely have the opportunity to return. We understand that each family has either, if a family has an extenuating circumstance, medical related or not, they can continue to learn remotely. We ask that if you have any questions as to whether or not you feel it is safe or not in a school, do reach out to the school, and we can certainly have a team, our team walk through the questions with you. But no, at this point, if a family does not feel safe, they can continue to learn remotely.
Why would we make this change now with just a few months left in the school year?
Yeah, so we believe that the best learning environment for many of our students is an in-person learning environment. We know that in addition to some of the challenges that many of our students are having, we know that not only there are academic challenges that we want to be able to support our students with, but we also know that there's the social emotional component of this. We know that many of our students have experienced and are still experiencing levels of isolation. And so we want to make sure that students have the opportunity to access those supports in school. And the other thing is that while I understand that it's almost the end of the school year, we have a quarter left. And we believe that even one day, every minute counts to us. And so to the extent possible, the returning students, if that is what is best for that student, then we will make that happen. And we know that there were hundreds of families since January, right, that had been on a list waiting to have the opportunity to return. And so we're doing that. We're doing that now.
And related to the timing of the return, why not allow additional time for teachers and staff to be fully vaccinated?
Yes, so we know that, which is something that I referenced in the last town hall, right? The CDC guidance tells us that we don't have to wait for staff to be vaccinated, that we can have students return in the middle of that process. And we also know that the vaccination alone does not protect our staff, right? It is what we call layers of mitigation strategies. This is something that Dr. Rowland was speaking to us about a few minutes ago, that it's the masking, it's the hand washing, is the distancing to the extent possible, is the vaccination, right? All of these pieces kind of put together continue to increase the level of protection. And one other piece that I will add is that we know that there are staff that have accommodations at this moment that may not be able to return on the 29th, However, our school leaders have been working diligently to make sure that the students that are returning, have a staff member that is going to be ready to continue their instruction while they're, in addition to their teacher, for example, being remotely delivering the instruction. And so, although that's a small number of staff, know that we are ready, and we can't wait to have and see our students in person.
For students that remain remote, will they keep current teachers and schedules?
That's a great question, and I'm going to ask Dr. Negron, our Chief Academic Officer, or Chief of Schools, Yvette Avila, to speak to the details. I'm not sure if they're.
No, I had to unmute. Dr. Torres Rodriguez, good evening. It depends. So it's an individual school. I can't say that all there might be, but that school leaders have worked diligently to minimize any changes for our students coming back. So there might be additional lunch periods, for example, which might change the schedule so that we can support distancing. But the actual schedule for the entire day has not changed. So the start of school will remain the same, the end of school will remain the same. Sometimes within the day, the child's schedule might change, but not the beginning and end of school.
And those are communicated ahead of time with our families.
That is correct.
And will they continue to get the same attention or attention as in-person learners?
Yes, for example, in many of the cases, there are, we have the concurrent teaching that will happen, right? Where we know that some of the students that a teacher has on their list are going to transition to in-person, and some will remain remotely. And so the teacher will teach both sets of students, and so the content will be the same.
This question is asking about concern over an increase in cases and the variant, and that hospitals have additional protection. How would that apply to us?
That's a great question. Dr. Rowland, do you want to help us answer that?
Yes, thank you for bringing that forward, and that's something we're watching very closely. At the present time, we've not seen a major effect by COVID variants, but that is, an obvious concern. And I think it's the reason that the vaccines that we have are very important, but we're not going to change our behavior 14 days after the second dose. That's when we're going to continue to mask, continue to use proper hand hygiene, and use careful distancing. So I think it's something I know we're going to watch very carefully in the community, and we may alter our course in the future if we were to see a third surge. Thankfully, as the superintendent demonstrated earlier, in our community, we continue to see a relatively low number of active COVID cases, and that continues to decrease.
Thank you.
The staff are receiving vaccinations, but not students. What protects students from each other? And why is it okay for children or kids to gather together in large settings, even though they have not received the vaccine?
Dr. Rowland, can you share with us, well, we know what the CDC guidance says with regard to the level of positivity for younger students, but
Right.
perhaps you can also share.
Well, we know that thankfully, COVID cases in our children really accounts for less than 1 case in 10. They're very thankfully uncommon. And we also know that kids are less likely to have serious side effects from COVID. And we know that children are less likely to spread COVID than older adults. Certainly it is a concern, but at this point, based upon CDC guidance, we feel that it is appropriate to allow our, our children to return in the school setting.
So this question is about, and I'm not sure if they mean they're coming back in person or they're already in person, but if they had concerns switching back to remote, is that a possibility?
So if a student, so let's play it out in different scenarios since we're not sure which one it is. So if this is a student that is in person and they want to shift to remote, that would have to be a conversation at the school level, given that we have to be mindful of changes in the number of students that are assigned to a teacher. And the same would apply if it's a student that is coming in on the 29th or after, and then decides that they want to go back in the opposite direction. Again, those are individual conversations that have to happen at the school level, given that, there could be shifts in the number of students that teachers are allowed to have. And this might be a time where Chief Avila, I know earlier one of the questions was about teachers and whether students would have the same teacher. So I don't know if there's anything else that you would like to add to that answer that I just gave about this scenario.
Yes, thank you, Dr. Torres Rodriguez. School administrators are doing everything possible to keep students with the same teachers. However, there may be situations where they don't have the same teacher. As students return in person and the shifts happen, we have to make sure that our students have the right number of students in each classroom. And so therefore we might have a shift in teachers, but we minimize that shift and providing concurrent instruction and having other strategies to try to make sure that they remain with the same teacher.
Thank you.
What will happen with transportation?
So we can, I can have, it's a broad question. So I'm in addition, we can review the mitigation strategies. For example, what would happen, in terms of the disinfecting of the buses after each ride, the airing of the buses by having the windows down, the masking. But I can also ask our Chief of Operations, Ms. Davis Gooch, to speak to any additional information regarding transportation.
Yep, thank you, Superintendent. We want our families to know that all of our remote students who are eligible for transportation will have transportation starting March 29th. So if you have any questions or concerns about what your bus stop information may be, feel free to contact the transportation department. I hope I'm about to give the right phone number. I believe it's 860-695-8876. In any case, if that is the incorrect number, please call the Welcome Center and they will direct you right onto the transportation department.
Thank you.
Let's see, is there going to be gym class, and are students going to wear masks during gym class?
It's a great question. Yes, gym class, and we can answer this question from two angles, and we can have Ms. Kamaitis from a health and safety lens answer the question.
Thank you. I would say that we'll be utilizing as much outdoor space as possible for gym class. Also utilizing our gyms, which are large open spaces. And also when inside, sticking to lower aerobic activities while definitely still maintaining as much distance as we can.
And the masking.
And the masking. Yes, thank you. And the mask.
How would an asthmatic student get a mask break?
Ms. Kamides, that is a great question.
Yeah, that is a question. That is a great question. We understand that some students may need more frequent mask breaks. And I would ask a parent to contact your school nurse, your child's school nurse, and they can work with the teacher and the principal and come up with a schedule for more frequent mask breaks. I think that's something that we could certainly accommodate.
I agree. Thank you.
What is the protocol for students eating in a crowded cafeteria?
Yeah, that is a great question that came up earlier in our staff town hall, and Ms. Davis Gooch addressed that.
Yeah, so as we know, we have asked our school leaders to take to make sure that there's that 6 feet distance in the cafeteria. So we are rearranging furniture, we are measuring, we're doing all the things to make sure that happens, because we know that when children are eating, they don't have on their mask. And so we're aligning ourselves with the CDC guidelines that says that they should have the 6 feet difference. In rooms where that's not possible, in cafeteria spaces, schools are either identifying another eating location for students, whether in some cases that may be the classroom, it may be in the auditorium. And so those things are happening in rooms in any room where there is concern around the level of capacity of that room. We will be taking the next step of ensuring that we're putting some ventilation systems in that space. Most likely it would be an air purifier.
Thank you, Ms. Davis Gooch. And I don't know if the question is going to come up here, but I know that there was a question earlier about our ventilation systems and work that we have done to make sure that we are upgrading accordingly.
Yep, we sure are. We have at the end of month of February, we have upgraded all our filters in our HVAC systems to the MERV 13 that is recommended by the CDC. In addition, we continue to ensure that our schools that have window air units, that those systems are adjusted to ensure that we have the fresh air intake in the room, and they are also cleaned regularly. So we are pleased that we have, in many cases, been higher than what the CDC recommendation has asked us to be, and we continue to monitor.
Thank you, Ms. Davis Gooch. And thank you also for our facilities and maintenance team. I know that twice already this year, there has been the upgrading of the filters. Every time that happens is over 7,000 filters throughout the district. And so, and that has happened twice this school year. So I just want to say thank you.
There were several questions regarding uniforms, and someone that said that uniforms were on back order. What should they do about that?
So I know that Chief of Schools, Ms. Avila, can speak to that, but before turning it over to her, know that we will not turn any student away because they do not have a uniform. So I just want to make sure that we have that understanding. The priority that we have is that having our students in the classroom with us. So Chief Avila, if there's anything else that you want to add, or perhaps Ms. Nouchette Blackburg, given that we know that we have ample supports for families that need uniform support.
I'm gonna go ahead, Ms. Blackburg.
Thank you, Chief Avila. Yes, so if where you go to for uniforms have shared with you that uniforms are on back order, we do have uniforms on hand right now in our Welcome Center. So please call 860-695-8400 and they'll be able to assist you with that. Again, 695-8400, they'll be able to assist you with uniforms. But I do understand that many of the outlets that we send our families to, some of those may be on back order, but in our Welcome Center, we have uniforms currently on hand.
Oh, my daughter is pre-K 4. Does she need to carry her iPad back and forth to school?
Great question. Either Ms. Davis Gooch and Ms. Avila. I know that that is something that we are eagerly trying to minimize. We actually do not want our students to kind of go back and forth. We're working really hard to have a set for each student so that they can keep their device at home and then have access to another device at school. But I'll see if either one of them can add anything else.
Yep, you certainly captured it. The team, the technology team at the district level is doing all that we can do to make sure that we have enough devices on hand at the district level and at the school level to ensure that our students do not have to bring back and forth their device. So that is an ongoing implementation and rollout of ensuring our students that we're moving to a one-to-one device setting in all schools.
Will there be aftercare and after-school programs available?
Yes, our partnerships with our community-based organizations are so important to us. Ms. Nushette Blackburg.
Thank you, Superintendent. And yes, I have a visitor with me. We do have after-school partnerships that are available. That is something that, yes, through the Office of Family and Community Partnerships, we can assist you, but first have that conversation at your school with your family and community service support provider and/or your principal, and they'll be able to share much more detailed information about the after-school programs available in your building. But again, we are here to assist you with that in our Welcome Center, as well as through the Office of Family and Community Partnerships. Thank you, Superintendent.
That's my friend in the background.
Yes.
My reader and writer friend. I know all about you.
And that is the roundup of our questions.
Wonderful. Thank you again, everyone, for joining us, and thank you for your partnership, your patience, and your support throughout this extremely challenging year. We're hoping to have more students in person, and for those of you that are staying home, know that we're here to support you in any way that you need. And so I wish you a great evening, and please stay safe and healthy.